Welcome to Soni Irabor Live. And today is a very special one for me because we're going to talk to somebody that I've known, well, practically all my adult life. And he's a man who has also encouraged me to be what I am today. But I think the most interesting part about this man is he's an enigma. I call him that because you don't know what is going to spring on you next. But let's start with his early lives. How did he become the great man that he is today? Soil scientist, desert warrior, corporate executive, and all of that. Well, let's meet Dr. Newton Jibunoh. How are you, sir?
Thank you very much, Soni. It's nice to be on your show once again.
Yes, once again. In fact,
I have lost count of the number of times I have appeared on your show, but so very interesting.
I'm honored.
And I must thank you for having me.
Thank you very much. Now, can you just share with us your early life? Because, as I said, you're an enigma of sort. But then we will talk about your age at the end of the show. How did it all start?
Well, let me start with my age, Sonny. I was born in the year 1938.
38?
Right. 38, yes. 1st of January, 1938.
Okay.
I lost my both parents at the age of 3.
Wow.
But I didn't get to know until I was 7. And that was when my adventurous life started. I'll call it adventurous, but in a way, that was also when the scholarship that took me everywhere started. The scholarship will go with a short story. Between age 7 and 9, I lived with my uncle in a wonderful extended family structure, culture that we have in this part of the world. It was like he tried to be my father. But it was not that easy for him because he had a polygamous setting.
Okay.
Many wives and many children. So it wasn't that easy for him to accord me that fatherly love. All the same, he took me to some very special, like going to neighboring villages twice a week to a place called Anam, a fishing village. Because he loved fishes.
And that will be across the Niger, right?
That's right, yes.
Okay.
My responsibility was to go to this village like twice in a week to bring fresh fishes for domestic use. And you know, the fishermen did their fishing expedition overnight. So I would go there night before and sometimes go with the fishermen on a fishing expedition. And in the process of doing that, they taught me how to fish. So in bringing the fishes back to my uncle's home for their use, I also had the opportunity of bringing my own fishes that I fished. And usually on the market day, I would take the fishes that's my own part, to the market to sell, to support the kind of scholarship that I had from my uncle, that is buying my books and sometimes paying my fees. But on getting to the market, you will hear women say things like, oh, that's the young man that lost his parents, that's the young man that do not have parents. And my fishes went within a few minutes with a premium. You know, fishes that would normally sell for, say, today's price of about 2,000, they were paying 5,000 for it. So I found myself becoming fairly well-to-do from the fishes that I caught, from a message of going to some village to bring home fishes. So when I say that my scholarship started very early, I regard such gestures, such kindness from communities.
Right. But then when did you now get to school?
Well, though interrupted from, that takes me to something else, because while this was going on, a school teacher, a secondary school teacher came to the village looking for a houseboy, looking for somebody to help him out with his domestic work. And my uncle found out a very nice way of not just helping me, but helping the teacher that was looking for a houseboy. So I was asked to go and live with this teacher, Okanike. He passed only a couple of years ago.
Okay.
And I lived with him almost all through my secondary life. And he took rest for most of my secondary education phase, though I continued to carry on with extra work here and there to help myself out, especially if I needed to have a new uniform. I didn't have anybody to go to. If I needed to have if I joined the scout movement and I needed to buy all the things that was needed, so that was how all the adventurous life.
Okay, we'll take a short break, and when we get back, then we'll continue with the story, because we're still in its very early stages. We'll be right back. Welcome back. So, we were talking to Dr. Newton Jibunoh. We call him the Desert Warrior. Dr. Jibunoh, welcome, sir. Now, we're still at your early life, where you were with your school teacher, who became your, was he a benefactor or your mentor, or somebody you were living with? Yeah? Now, can you tell us how you managed from there to a normal formal school?
Well, you know what happened in those days, when you're to a school teacher, you are treated very differently. Sometimes they have a way of pushing you and taking you up on a number of subjects, especially once you miss due to the domestic work you needed to do from time to time. So I managed to scale through that over a period of 5-6 years by having a proper, what you would call a proper secondary education. And it was after my secondary education that I left that Midwestern part, relocated to Lagos, where I started working for the Federal Ministry of Works. You know, in those days, it was a lot, with your school certificate result, good one, you were able to get jobs. And I got a job with the Federal Ministry of Works. And from there, I started now looking for bigger scholarships by sitting for scholarship examination. Then Nigeria was a different place. And I'm talking about the 50s, 60s. Government had what known as the Federal Scholarship Board, where, you know, especially coming from a very less privileged background, was filed for scholarship. And I did. I did in 1960. I didn't do too well. But in 1961, I scaled through, and that was how my resurgence to now go abroad, building and civil engineering. And that goes to now bring me to another story of transiting between childhood and adulthood. You know, at that age, you are probably beginning to get involved with those things that shape your life by finding mentors, by listening to those that have done impossible or difficult things. Like things like I Have a Dream speech by Dr. Things like words like "Do not ask what your nation can do for you" by John F. Kennedy.
John F. Kennedy, that's right.
Yeah, that's right. Yeah, speeches like that Kwame Nkrumah made when he became prime. When he said things like the freedom of independence of Ghana was meaningless until the rest of the continent is freed. Mm. And then, of course, my biggest of them all, mentor, Nelson Mandela, who said that the emancipation of his people was something he was ready to give his life for. You know, all those speeches where the things shaped me. Because from there I started developing interest in knowing how these great icons came to be who they were, and emulating them, listening to them. In the case of Kwame Nkrumah, I followed his development all through his period. Then, of course, Nelson Mandela, I followed his arrest and all through his period in prison. And as a matter of fact, I started joining demonstration on the Free Mandela movement, and I rose to become the vice president. So things like that kind of shaped me transiting between childhood and adulthood.
Wow. Now that brings us straight to the desert issue. In 1966 or 67, you did a daredevil thing. You crossed the Sahara Desert alone, driving yourself after your graduation. Can you put us through that?
Yeah, it was in the end of 1966, to be precise, 27, 1966, that I set out. Sorry, it was the era of the space race, and like I said, it was the era of civil rights movement that spread all over the world. It was the era of age era. It was also the era of women liberation. Having been in London for 5-6 years, going through all that, and like I said, joining the Free Mandela movement, I became a completely different person. And the question now came, what was I going back to my country for, and how prepared I was? Especially having seen that some of those that graduated with me were going to go into greater things like space exploration, the same mathematics, the same chemistry, the same physics. And the question now came, why are they different from us? Why is it that they are the ones exploring and inventing? And, we don't do much. And I found out that it is because they explore. They break the boundaries and cross over to the territories and adventure, which we don't do. So I then decided that for me to be able to be part of that era, I needed to do something. I needed to show not only to those that sponsored me that I have become part of that era. And that was how the decision was made by driving my car all the way from London to Nigeria. It wasn't meant to be a solo expedition. I had planned it with an English friend of mine who graduated about the same time with me. Mm-hmm. Not only that, he graduated about the same time, worked in the same office in London where we graduated. But somewhere down the line, we were talked, or he was talked out of the expedition. Parents just wouldn't let him get back on such a journey. And that was how I decided that since it was something I was convinced, and since I had gone on to calculate all the risk, I was capable of going it alone, and that was how. Yeah, I set out on the 27th of December, 1966.
Hmm. Now, you were approaching your birthday because 22nd or 27th of December, 1st of January is your birthday, which is the beginning of that year. That meant that you must have been in the desert during your birthday. Is that true? It was your birthday, yeah? On the 1st of January. You were still in the desert that time.
Yes, yes, I celebrated my birthday during that. And if I tell you what, because living in London, a lot of my friends and a lot of my colleagues where we worked, a lot of my closest allies did everything they could to stop me from going. Put me letters and sent me cards. My professor, Professor Koshiba, I think he's still alive, wrote me and said, Newton, this is not a good way to die. Strangely enough, I did not read those letters and cards until on my birthday, 1st of January. And of course, it brought quite a lot of tears to my eyes. But you know what happens when you cry? After wiping away the tears, you tend to gather more strength and more courage.
So you went into it anyway.
It was nice that I experienced my birthday during that very point, yes.
Okay. Now, let's leave that aside for now. You came to Nigeria and then met new friends, family members, and entered the corporate business. When did you join Costain?
Well, I went back straight to Federal Ministry of Works because a part of the scholarship was that came from the Ministry of Works.
Okay.
And I needed to go back there on my returns. In fact, they were at that time expecting me, but they didn't know I was going to come back. So I just showed up in the office and then started 67 years, that's right, yes. And I was posted to take charge of the Jura Causeway project. I was the project manager there. And the project was starting, and since I specialized in soil mechanics, I was put in charge of the geotechnical works, that is the soil investigation and the substructure works on the Jura Causeway. It was a wonderful responsibility sponsored by World Bank, and I had a World Bank engineer who I was reporting to. Things didn't go too well between us. It's a long story, and I don't want to go into that now. An Englishman. So after about 1.5 years, I tendered my resignation, left to join Costain, West Africa. And this is, but so for this, most of what shaped me started from there because I had bigger responsibilities. I have built power stations, I have built water supply, I have built roads and bridges, I have built all over the country. And that, especially with the multinational organization like Costain, realizing the kind of adventurous life that I had, they were posting me to some of the most dangerous and most difficult part of the country.
Yeah.
If you go around virtually everywhere, from the north down to the south, from the east down to west, you will see.
In that way,
yes.
Right. In that way, you were able to see how the temperature of the climate went, how the forests or vegetation changed. Can I just take you straight into what is now befalling the whole world, climate change? Because you sounded a note of warning in your books and all of that.
Yes, I have worked all over the country, particularly in the far north,
Yes.
Sometimes I recall going from Maiduguri to Lake Chad to fish and to while away my time. I saw what desertification was beginning to do to a good part of the northern part of Nigeria. The farming communities, the grazing fields were disappearing. And you see, let me now paint a completely different picture for you to, and I will do it in a fairly simple way. At that time, and I'm now talking of the 70s, the 80s, and 90s,
Yes.
The global climate issue has become a topical issue. And then on that, you had two extremes. The Amazon rainforest in South America that was helping to mitigate against the change issues. And then you had the Sahara that was doing the very opposite, pumping global warming into the atmosphere on a daily basis. The Amazon, the rainforest in Amazon was receiving global. Billions of dollars were being pumped into mitigating to stop the Amazon from depleting. Whereas in Africa, the Sahara, nothing was being done.
Nothing was being done. Oh, wow.
Yes. So you see a situation where, yes, it was mitigated, and they were doing something so as to stop the depletion of the rainforest. Whereas the Sahara that was pumping more global warming issues into the atmosphere, nothing was being done about it.
Wow.
And I had acquired quite a lot of experience from my being a soil mechanic,
Yes.
working all over the country and seeing what the Sahara was already doing, especially to those countries that live on the fringes of the Sahara. I decided to join the debate on the climate change issue.
Was anybody listening to you when you were crying out?
It was difficult because it was like a lone voice. Then the fact that I had gone on an expedition and I knew what I was talking about, that helped a little bit. But all the same, for instance, I mean, I talked about the grazing fields, and I predicted, I'm talking about the 90s, that if nothing was done to restore the grazing fields, and if nothing was done to stop the Lake Chad from receding, that there was going to be conflict because the water bodies all over the north started disappearing. If the nomadic Fulani henchmen, who depend 100% on animal husbandry, with millions and millions of animal heads, that if they don't have any grazing fields, and they don't have any farmland, and they don't have any water bodies,
so they now move south.
Migrating.
Yeah. There was a village. There was a village you saved, Makoda, in Kano State, from desert encroachment. Can you please tell us more about that?
Okay. So, Soni, especially when you start participating in global debates on issues, yes, I have gone across the Sahara Desert, but having sufficient qualification to support my advocacy was very, very difficult. Back to Israel. I had to go back to the university in Israel to study the science of desertification. So yes, I had to do that. And it was when I now returned from Israel that I decided to start my own advocacy, an environmental advocacy body, Fight Against Desert Encroachment. And I used that instrument in carrying out further campaigns. I used that instrument in developing, because I continued to have the friendship of Alhaji Abdul, the then a Moroccan, who then introduced me to the Emirate of Kano and then later to the government of Kano State, Federal Ministry of Environment. And in partnership with them, they took me to the most encroached part of Kano State. In fact, a community that was already taken over or being taken over by the Sahara
Desert. Oh, wow.
Of Makoda. So, working with the district heads and the community, that's a project that is today known as Wall of Tree Project to stop the desert from encroaching. And within a period of 4 years, I was able to restore not only farming lands, I was able to restore grazing fields. And of course, water bodies started returning to the community. Those that had migrated out
now started coming back.
And you don't know what they did for me. Because all along, whilst this was happening, I lived in a tent. Because there was nothing like a hotel accommodation in the vicinity. It was desert. It was just desert.
And you lived with them, amongst them, and all of that.
Yes, that's right. As that was going on, with the Emir of Kano visiting the project, with the British High Commissioner visiting the project. Soni, I think you too did visit the project. They started finding out the kind of the caliber person. And all they did was question themselves. How can a man like this that can make the Emir come to Makoda, that would bring the British High Commissioner, because then the British government gave me some money for the project, and that would bring big opening ceremony for the Wall of Tree project that attracted almost 6 governors from the northern states. Somebody that will do that. So that was when they knew that and said to themselves, this man must not sleep. Come here and be sleeping openly in a tent. So they went. I think you saw the house when you came to Makoda.
Now, okay, because of time factor, I just want to ask one more question. Because concentration has been on desert climate change, desert encroachment. You've set up a foundation called Fight Against Desert Encroachment. Can you tell us more about that? We only have 1.5 minutes to go.
Well, it's at this time, Soni, all that pushed me to go on a second expedition. Because while this whole thing was happening, I needed to equip myself a little bit more. And we are talking about over 30 years from my first expedition. So I needed to refresh myself. I needed to know what I was talking about, especially since I had become like a global material for the advocacy against climate change. I needed to be fairly well equipped. So I went on a second expedition. And it was after that expedition that I established not only that I established the NGO Fight Against Desert Encroachment, it was subsequently accredited by the United Nations. So I now started participating fully as an accredited member of the climate change, part of the 29 conference of parties that have taken place all over the world. I have attended 15 of those all over the world.
Well, you're an ambassador of nature, if I should call you that, but because of time factor, we cannot continue. I will have to crave your indulgence. I don't know when you'll be in Lagos. I would like to have you live in the studio, because this is not a story that we can just whisk away like that. Please, I would just, as we end this conversation now, anytime you're in Lagos, please join me at Soni Irabor Live Studios, New Central, and then we'll talk some more very deeply about this, because there's so much we don't know about you. We need to know about you. Thank you so much, sir. Thank you very much for granting us your time.
Thank you, Soni.
Yes.
It's a pleasure.
Right. So, yes, we have been with Dr. Newton Jibunoh. We call him the desert warrior. But beyond that, he's a man, I will say this before he comes on live next time, that this is a man who spent most of his later years, from 75, now he's 86, he's been planting trees every birthday, every notable birthday of his, 1st of January. Well, I've taken joy in doing that myself, but I'll show you some of those pictures in another time. But going forward now, we have another, a lifesaver I should call him. He's a man who believes in how to show you the best way to avoid those things, the pitfalls that can put you in trouble. I'm talking of Dr. Richard Oyefeso. He's our next guest on Soni Irabor Live, this edition. Doctor, how are you today?
I'm doing very well. It's a pleasure to be with you, Uncle Soni, as my friends call you. Pleasure to.
But Robin, can you loan me some of your white beard?
It doesn't seem to do much. If only it could make me get money in the bank, it would be more better. Aside from that, it doesn't serve any purpose.
So welcome. You are in Canada, far away Canada. Where in Canada are you, by the way?
I'm actually in Ontario.
Ontario. Good.
Southern part of Canada. Yeah, that's where I hide my head with my family.
Mm-hmm. Well, your actions don't make you hide your head. You have been coming to Nigeria, going back to Canada. We are very grateful for that. But can you let us know the meaning of for baby for life, or for life for baby?
For breath for life.
For breath for life, sorry, yes.
For breath for life. Yeah, for breath for life is the name of our organization. And what we do is work to improve health indices in Nigeria, train healthcare providers, run some free health clinics, do some charity work, support orphanages, collaborate with governments, entities, individuals, and well-meaning people who align with the values that we share regarding the importance that every life matters. And we have to do all that is necessary to promote the life of individuals in Nigeria and to improve our sad health indices. As the name for Breath for Life, so we coined the name. So one of the things, so we breathe life. Breathing life into every difficult or even dead situation is how we like to put it. So that's kind of the synopsis of the origin of the name for Breath for Life. And we've been working in Nigeria now for over a decade. Humble strides, but trying to play our part.
How many parts of Nigeria have you covered so far?
We've reached 12 states in Nigeria.
12. Well, good.
Through our own direct work and also through some of the partners that we have in the country.
Mm-hmm. Now, okay, let's just understand a bit more, because from one of those things I read about you, you even went to the extent of training midwives on how to deliver women of their babies. Can you expatiate more on that?
Yeah, so what we find is that in every country across the world, there are different cadres of people who handle the delivery of women and delivery of babies, essentially. So many cadres. So doctors, nurses, midwives, and traditional birth attendants, and I believe some parts in Nigeria also community health extension workers. Essentially, the process of a woman delivering a baby appears simple in that someone is there to assist the woman in the safe entry of the child into the world. But the catch is that that process in itself is very tricky. Many times things go well, but when we run into problems, things can change very, very fast and can have traumatic impact on the mother and even the child, because at every delivery, you have two individuals whose lives are on the table, essentially. So it's important that a skilled provider is present at the birth of every child, a skilled provider. In our country, we have a peculiar situation because more than 60% of our women do not deliver in the hospital. In addition, more than 80% of healthcare costs are paid out of pocket. So there are other factors. The other issue is that many of our women also are not well informed about how to make the best choices for their health. At the same time, we have a high poverty rate that makes it difficult for people to access care at the highest levels. So that being said, you have many people who, on the lower socioeconomic status, for example, that require a lot of support to protect them. And there are many ways to do that while still achieving some kind of balance. But ultimately, as I said earlier, every life matters. So we have midwives who deliver babies. We have traditional birth attendants. For example, even in North America, midwives handle deliveries, and there are actually many women who even choose, a growing number of women who choose to deliver their babies at home. But that being said, those midwives are actually well-trained, well-equipped, and they have access to a support system for prompt referral in order to access higher levels of care. That being said, we also have centers in Nigeria that are really doing great work, offering great care, despite humongous constraints. So you have situations where people need to escalate care. They need to move to a higher level of care. But the capacity to pay becomes another issue. But ultimately, it behooves us to find ways around some of these problems that we can solve some problems now. We can save as many lives as we can while pushing towards utopia, as you might want to call it.
Well, there's something here that I need to explore some more about. What of those people who, in their, hinterland experience, they would rather say they don't want to go to any orthodox hospital. They would prefer to do it at home. And such people, they will tell you they were doing it long before Oyinbo people came. How do you manage such mindset?
Yeah, that's a very good question. I'm a Yoruba man, right? So I'm reminded of a saying in Yoruba parlance. It says, "Eku ewu omo." If you strip down that expression, it's literally congratulating a mother on surviving the danger of childbirth. Meaning that from time immemorial, in every part of our country, based on our cultural history, heritage, and all, it's clearly recognized that there's a certain danger attached to the process of childbirth. So that the point is that based on the fact that the pitfalls are recognizable, the dangers are there, it is important for us to, what we'll call, be proactive in order to anticipate where there can be pitfalls so that we safeguard against those. Most deliveries can happen naturally without even a skilled person present. But because many times you don't even know where the complications will come from. So it's important to have the right system in place in order to avert some of those preventable tragedies, for lack of a better word, because any core mistake that happens, the life of a mother, of a child, is at stake. So it is not enough to just assume that you can do it at home. it is important to also make sure that we safeguard against some of the potential perils that could occur. For example, one of the things we address is what we call birth asphyxia. When a baby is born, the baby is not breathing, and somebody needs to assist that baby in order for the baby to breathe. Now, the catch is that, and I tell everyone every chance I get, by the way, lest I forget, more than 700 babies die in Nigeria every day.
Every day?
More than every single day. I need to emphasize that. Every single day. Okay? We have the second highest infant mortality rate in the world.
Wow.
In the world. And also, the same way, about the second or third highest maternal mortality rate. Potentially, our country is one of the dangerous places in the world for a mother and her child. And that shouldn't be. And that should change, and that can change. So babies do not breathe when they're inside their mothers. They don't breathe. They don't need to breathe. We only breathe in order to get oxygen, to oxygenate our body into our bloodstream. Our cells need oxygen. Oxygen is through that the body gets energy. But while the baby is inside the mom, the placenta is the connection between the mother and the baby. So this blood that is filled with oxygen is just transmitted into the baby. Baby doesn't need to breathe. But once the baby is born, comes out of the mother, we cut the cord, the baby is supposed to start to initiate breathing so that they can take over that function themselves. But what we've seen over time is that sometimes for no clear reasons, sometimes for obvious reasons relating to the health and condition of the child and even the mother, that child doesn't start breathing on their own. Now, there's a phenomenon that we call the golden minutes. And the premise of the golden minute is that within 1 minute, which is 60 seconds,
wow,
within 1 minute of a child being born, that child should be breathing on their own. If the child is not breathing on their own, someone should be present who can assist that baby to breathe. And these principles are part of the guiding factors we cite around the training programs that we offer, that we're training people on this scale and also giving them the much needed equipment. Because there are many people across the country, many providers who have not been trained and also who don't have the equipment to use. Now, I have to quickly mention, part of what happens within the our orthodox system sometimes gets a bad rap for many reasons. So for example, we'll tell people, oh, don't just do things the traditional way, go to the hospital, go to the health center. Part of the challenge is that our health centers are not adequately equipped and adequately staffed. So there are people who sometimes will go to those places and they don't have a good outcome. The point is that we have to have a robust healthcare system that makes it clear without a doubt that you don't have any business going anywhere else. Well-staffed, well-equipped, well-run, well-managed, standards met, data collection, and of course, well-funded. So we have difficulties in that area. So that, and as they say that if the desirable is not available, then the available becomes desirable. Now, certain people will deliver at home. There still also needs to be a system to regulate that practice so that providers recognize that there are certain pregnancies you should not even consider delivering at home. Certain pregnancies are labeled as high risk. I don't want to bother you with the medical jargon, so that ahead of time it is clear that, oh, this lady has to deliver in a certain place because of a condition, certain conditions related to the baby. So there's a level of anticipation that is required. So we have many of those things missing on several levels. And I pray we were able to navigate these things, as they say, get our acts together, because people's lives are at stake for this.
I sense you talking between the lines, trying not to hit the nail on the head, but hitting the nail all the way anyway. Now, what do you advise policymakers to do? Because healthcare is a very important aspect of our lives. Same thing with education, same thing with surviving, same thing with being able to eke a living and all of that. What's your advice to policymakers?
And this is what I would say for policymakers. I think there are too many things that one can say. At the very start, every life matters. Every life matters. Every human being deserves a chance to live. Whether prince or pauper, the value of the life of every human being is the same. And we have a very sacred divine responsibility to protect every human. There are some errors, I would say, in how we approach things relating to mortality. Nobody's life is dismissible. The fact that someone is poor is not a crime. So whether you are in the most sophisticated part of Nigeria, highbrow area of Abuja, in a penthouse somewhere in Lagos, your life is of the same value as that little village kid in the most remote part of Sabongida Ora. Wherever every human being is, we have to protect the lives of Nigerians. Based on this premise, then this will start to inform our decisions. There are clear things that we need to change. We need to fund healthcare better, but in more practical ways. There are too many shiny objects that don't add value. I'll give you an example. For example, we may decide, let's build more hospitals in order to improve healthcare. The answer is no. We do not need to build more hospitals. We have too many existing hospitals that need to be improved upon. So to the providers, what are the existing facilities under your purview? And what can you do to improve them? And there are many simple things that can be done. They are not heavy regarding the budget. Now, thirdly, there are basic programs that are in existence that add value, very high impact programs. For example, one of the programs we promote that trains healthcare providers on neonatal resuscitation is clear, very, very straightforward. All that is required, we need to train as many of our providers as possible on the basic tenets of basic newborn care, basic health care, basic primary care. Training. And training across several levels. We have, they say, 774 local governments or thereabout in the country. Yes. And many of these local government areas have primary healthcare centers. We need to do a complete overhaul of our primary health centers. Not by doing big flashy things, but clean the place up, paint the place, make it presentable, get basic equipment in there, be able to offer a basic level of care, get staff in place in primary healthcare centers. People who do not like, many people want to be in Lagos, want to be in the cities, but create incentives for providers to be able to work in some of our rural and underserved areas. Pay them extra money so that they can be there. Also, create partnerships with the local communities so that they can also support you in the process. Government cannot do it alone. The government needs to pay attention to many non-profits that are doing great work and looking at how do we partner in these areas in order to get jobs done.
Do you get partnership, by the way? Do you get partnership?
Do we get partnership?
Yeah.
And you mean from the government?
From the government. From the government. From any government, yes.
At this time, the answer is zero. We do not. We would love to. We have also tried, but it hasn't been successful. But definitely look for trying. But we are constantly trying to engage. But one of the things that we've done in the past is government has helped us to be able to gain access to their workers. So there are some states where we've worked where we will come boots on ground to do training sessions, and then we will get representatives from local governments across the states, and then train these providers so that they're able to go back to their communities. But the point is that it's a bit of a challenging process, but at the same time it's a simple process. Train people, put equipment in their hands, follow up with them, supervise them, monitor their work. The other thing I will also add is that government needs to be sincere, because there are many people that struggle with sincerity and the promises from government. If we make ourselves available, if we do this or that, will government support us all the way? Will things change when somebody else is on the seat? And will they, do different things like that? But in reality, there is an amazing opportunity for public-private partnerships, amazing opportunities. And I would also add, for someone like me, as they say, I'm in the diaspora. I tell people that I may be in Canada. I also spend some time in the US as well. I may be in North America, but I promise you, without a shadow of a doubt, my heart beats in Nigeria. I can't help it. I care about Nigeria. I'm up to date more than anybody can realize on what is happening in Nigeria, because that is the place that I love. That is the place that has given me life, and we have to be a part. People like me, there are folks like us abundant across the globe, doing great things for other countries, while our country is in trouble, to be quite honest. But our resources can be harnessed for the betterment of our country. I'll quickly mention the saddest thing that happened is the so-called brain drain, where many brilliant minds have left Nigeria and still living by the minute. But there is a special opportunity for brain gain. A special
brain
opportunity
drain to brain gain.
Absolutely.
Well, thank you very much, Dr. Richard Oyefeso. One last question before I say bye-bye fully. This thing you're doing with your fellow professionals who are non-Nigerians, but they come. Don't they ask you for payment for anything of this sort? Or this is all pro bono and all that?
Mr. Irabor, I've seen amazing displays of human kindness. Across the world, we're in awe of great people that we see who connect, regardless of where they're from. I think they only see there are many people that just see one race, and they just see the human race. And that if they have opportunities to save life and give life wherever they find themselves, people are very happy to do that. I must also mention that we also have great Nigerians that have done amazing things and still doing, as folks partner with us and all that. But we need to hurry. Like they say, if you remember in the movies, it's almost like the forces of good and evil, whereby there's some evil that is happening, a great evil enemy is impacting the community. And then the forces of good, after being bruised and battered by the enemy, they now start to organize themselves. They study the enemy. So our enemy is the problem. Our enemy is a problem that many of the people don't have adequate healthcare. Then we need to study that problem. Then those that are addressing it need to now start to work in synergy and collaboration in order to make a difference. I can't emphasize this anymore, emphasize it enough, that too many people are doing good things in silos. but it's more than ever before. It is pertinent. It is pertinent that we start to work together in order to save lives and be a more efficient force for good for our people and our country.
Thank you very much, Dr. Richard Oyefeso. Thank you so much. And as you continue this your humanitarian work, we'll continue to look out for people like you, to encourage you, and to say a big thank you on behalf of those who are not, privileged, but they have opportunities. Thank you so much.
I would also quickly say, I call it about triple M. Triple MMM.
What
Money,
is MMM?
Money meets meaning.
Say that again.
Money meets meaning.
Money meets meaning. Ah, fantastic.
Full of means. There are all those your rich friends and corporate entities. They're pockets of resources. We can bring meaning to those financial resources to save.
Thank you so much indeed. God bless you. And so we've had Dr. Richard Oyefeso, another humanitarian figure. Well, the first one was, of course, Dr. Newton Jibunoh, 86 years old. Yes, but he's still high riding fast, trying to ensure that climate change, come what may, it should not consume us. We should be able to manage it. So it's been Soni Irabor Live. Thank you so much. And next week is another day. Oh, by the way, we are having in the studio, yes, Senator Shehu Sani on Saturday, 8 p.m. next Saturday. Bye-bye now.